Ladies and gentlemen, I am Dr. Aurangzeb. I'm a consultant cardiologist, and in today's video I am going to discuss with you people what is the recommended technique for performing blood pressure measurement. If you are new to my channel, I will request you to please subscribe to my channel and press the bell icon so that you receive notification for future videos. What is the importance of standardized technique? We all know that blood pressure monitoring has been described as likely the clinical procedure of greatest importance that is performed in the sloppiest manner. Because blood pressure is a highly variable physiological parameter that is sensitive to numerous endogenous and exogenous stimuli, it must be performed meticulously with strict adherence to standardized technique. This is not often done in conventional clinical practice, and this type of non-standardized measurements has been termed casual BP measurement. A major barrier to adopting proper measurement technique in the office setting is lack of time, and casual measurement technique readings are on average 5 to 10 millimeters of mercury higher than standardized technique and have greater variability in blood pressure measurements and lower correlation with target organ damage compared to standardized measurement. This can lead to inaccurate diagnosis and management of hypertension. In the coming slides, we are going to focus on how to precisely measure blood pressure with standardized techniques. For any blood pressure measurement, you need a device, and we have two types of devices. The first are automated devices. The importance for automated devices is that they must be validated by comparing the automated device against two observer mercury auscultation. Validated devices can be found in various registries, the details of which I have mentioned in the description of this video. And the other are the Android devices, and they must be calibrated every 3 to 6 months so that they remain accurate. This is a standard Android sphygmomanometer or blood pressure apparatus. It has got this inflatable bulb, this pressure cuff, this air release valve, these tube connectors, the artery position indicator label, and the Android manometer gauge and the index marking. A few important things about the blood pressure apparatus cuff. The cuff that belongs to the device should be used for all measurements. It should be appropriately sized for every patient. There should be a wide range of cuff options to accommodate various arm sizes. The inflatable cuff bladder width should be 40% of the arm circumference. The inflatable cuff length should be 80 to 100% of the arm circumference. For automated measurements, the cuff should be applied per the manufacturer's specifications. For auscultatory measurements, the cuff should be placed so that its lower edge is 2 to 3 cm above the elbow crease, the cubital fossa, and the brachial artery marker in line of the brachial artery. These are the important things that you should remember about the cuff. How to prepare the patient? The patient must be on empty bladder and have not done any of the following in the last 30 minutes before blood pressure measurements. He shouldn't have done any exercise, shouldn't have smoked, shouldn't have consumed caffeine or eaten. And cuff should be applied to the exposed arm with loose clothing above, or the cuff applied over very thin piece of clothing. This is the position of the patient. The checklist is: feet should be on the floor, back well supported, legs uncrossed, arms supported, and BP cuff at the level of the heart, right? In this position, the patient should be instructed to sit for 5 minutes. During the rest period and measurements, the patient and the observer should not talk. This is the most important step. Both the observer and the patient should remain calm, and they should remain quiet while the rest period is being observed. How to measure? On initial assessment, blood pressure should be measured in both arms, and on subsequent blood pressure measurements, take blood pressure in the arm with the higher readings on the initial assessment. On initial assessment, check blood pressure in both arms. If, for example, in the right arm the blood pressure is more than in the left arm, and normally there is a slight difference in blood pressure measurement in both arms. So for subsequent measurement, you should take the arm with the higher blood pressure measurement on initial assessment. 2 or 3 measurements should be taken and the mean should be recorded as the office blood pressure measurement. This is how to measure blood pressure using an NRI device. The patient is sitting comfortably, the cuff is at the level of the heart, the stethoscope is placed over the brachial artery so that we can hear the pulsation of the brachial artery. This is the bladder and this is the air release valve. These are the connectors, and somewhere here there is the manometer gauge. Here we can see that for an automated device, the manufacturer specifications should be followed. Generally, the bladder should be at the level of the heart, and you have to push this start button. Once it calculates your blood pressure, you will get this systolic reading, this diastolic reading, this pulse. You then stop. You can then store this as well for future record and references. When measuring blood pressure with an NRI device, the most important step is the auscultation. While palpating the radial and brachial pulse, you should inflate rapidly to 30 millimeters of mercury above where the pulse disappears. So first you have to inflate the bladder and the cuff. By synchronizing it with the brachial or radial pulse, you have to rapidly inflate the cuff to at least 30 millimeters above where the pulse disappears, and then place the stethoscope on the brachial artery and listen while deflating the cuff, and the rate of deflation should be 2 millimeters of mercury per second. The first quarter-cough sound corresponds to systolic blood pressure, and the point the sound disappears corresponds to the diastolic blood pressure. If the sound persists towards 0 millimeter of mercury, the point of muffling should be used as the diastolic blood pressure. Blood pressure should be recorded to the nearest 2 millimeters of mercury. Again, you can take 2 or 3 measurements and use its mean to calculate the office blood pressure measurements. If you are using automated device, initiate measurements per the manufacturer's specifications. Thank you very much. I hope you have learned something, and I again request you, if you are new to my channel, please subscribe to the channel and press the bell icon for future videos. Thank you so much.